Asthma is a chronic respiratory condition that affects millions of people worldwide. Diagnosing asthma can be complex because its symptoms often overlap with other respiratory illnesses. In this video, we'll walk you through the step-by-step process doctors use to diagnose asthma. From understanding your symptoms to performing specific tests, each step is crucial in ensuring an accurate diagnosis. Whether you're experiencing breathing difficulties or just curious about the process, this guide will help you understand what to expect during an asthma evaluation. Let's begin by looking at the first step doctors take when you visit with breathing concerns. Diagnostic journey starts with a detailed patient interview. Doctors will ask about your symptoms, such as coughing, wheezing, shortness of breath, and chest tightness. They'll want to know when these symptoms occur, how severe they are, and if anything seems to trigger them, like exercise, allergens, or cold air. Your medical history is also important, including any family history of asthma or allergies. This conversation helps the doctor form an initial impression and guides the next steps in the diagnostic process. After the interview, the doctor conducts a physical examination. This usually involves listening to your lungs with a stethoscope to check for wheezing or other abnormal sounds. The doctor may also look for signs of allergic conditions such as eczema or nasal swelling, which often accompany asthma. While a physical exam alone can't confirm asthma, it provides valuable clues and helps rule out other causes of your symptoms. Thorough review of your medical history is essential. Doctors will ask about previous respiratory illnesses, hospitalizations, and any medications you're currently taking. They'll also inquire about exposure to environmental factors like tobacco smoke, workplace irritants, or pets. Understanding your background helps doctors identify patterns and risk factors that may point toward asthma or another respiratory condition. Doctors pay close attention to the pattern of your symptoms. Asthma symptoms often worsen at night or early in the morning, and they may be triggered by exercise, allergens, or respiratory infections. By analyzing when and how often your symptoms occur, doctors can distinguish asthma from other conditions like chronic bronchitis or heart problems. This step is key for narrowing down the diagnosis. During the examination, doctors look for physical signs that may suggest asthma. These include wheezing, rapid breathing, or use of accessory muscles to breathe. Sometimes the physical exam may be completely normal, especially if you're not experiencing symptoms at the time. However, any observed signs help support the diagnosis and indicate the need for further testing. One of the most important tests for diagnosing asthma is spirometry. This simple, non-invasive test measures how much air you can inhale and exhale and how quickly you can blow air out. Spirometry helps doctors assess lung function and detect any airflow obstruction, which is a hallmark of asthma. Let's see how this test is performed and what the results mean. During spirometry, you'll be asked to take a deep breath and blow as hard and fast as you can into a mouthpiece connected to a machine. The device records the amount and speed of air you exhale. The main measurements are FEV1 forced expiratory volume in 1 second and FVC forced vital capacity. Reduced values may indicate asthma, especially if they improve after using a bronchodilator medication. To confirm asthma, doctors often repeat spirometry after giving you a bronchodilator, a medication that relaxes the airways. If your lung function improves significantly after using the bronchodilator, it suggests reversible airway obstruction, which is characteristic of asthma. This step helps distinguish asthma from other lung diseases that may not respond to bronchodilators. Another useful tool is the peak flow meter, a handheld device that measures how quickly you can blow air out of your lungs. Doctors may ask you to use a peak flow meter at home over several weeks to track your lung function. Variability in peak flow readings, especially when symptoms worsen, can help confirm an asthma diagnosis and monitor its severity. Since allergies often play a role in asthma, doctors may recommend allergy testing. This can include skin prick tests or blood tests to identify specific allergens that trigger your symptoms. Knowing your triggers helps doctors tailor your treatment plan and advise you on how to avoid or manage exposures. Asthma symptoms can mimic those of other illnesses such as chronic obstructive pulmonary disease, COPD, heart failure, or respiratory infections. Doctors may order additional tests like chest X-rays or blood tests to rule out these conditions. This step ensures that the diagnosis is accurate and that you receive the most appropriate treatment. Spirometry results are normal but asthma is still suspected. Doctors may perform a methacholine challenge test. Methacholine is a substance that can cause airway narrowing in people with asthma. During the test, you inhale increasing doses of methacholine and your lung function is measured. A significant drop in lung function confirms airway hyperresponsiveness, supporting an asthma diagnosis. Some people only experience asthma symptoms during or after exercise. To diagnose exercise-induced asthma, doctors may ask you to perform physical activity under supervision, then measure your lung function before and after exercise. A drop in lung function after exercise can confirm this specific type of asthma. Fractional exhaled nitric oxide (FeNO) test measures the level of nitric oxide in your breath, which can indicate airway inflammation. High levels are often seen in people with allergic asthma. This test helps doctors assess the degree of inflammation and guide treatment decisions, especially when the diagnosis is unclear. Once asthma is diagnosed, doctors assess its severity. They consider how often you have symptoms, how much they interfere with daily life, and how frequently you use rescue inhalers. Severity assessment helps determine the best treatment plan and whether you need daily controller medications or just occasional relief. Doctors also evaluate how well your asthma is controlled. They may use questionnaires or ask about recent symptoms, nighttime awakenings, and activity limitations. Good control means minimal symptoms and few disruptions, while poor control may require adjustments to your treatment plan. Asthma is a variable condition, so ongoing monitoring is important. Doctors may schedule regular follow-ups to check your symptoms, lung function, and medication effectiveness. Keeping a symptom diary or using a peak flow meter at home can help track changes and catch flare-ups early. In some cases, your primary doctor may refer you to a pulmonologist or allergy specialist. This is especially true if your diagnosis is uncertain, your symptoms are severe, or you're not responding to standard treatments. Specialists can perform advanced tests and offer expert guidance for complex cases. Getting an accurate asthma diagnosis is vital. Misdiagnosis can lead to unnecessary treatments or missed opportunities to manage symptoms effectively. By following a structured, step-by-step approach, doctors can ensure you receive the right care and avoid complications. Education is a key part of asthma management. Doctors will explain your diagnosis, discuss triggers, and teach you how to use inhalers or other medications. They may also provide written asthma action plans to help you recognize and respond to worsening symptoms. An asthma action plan is a personalized guide that outlines what to do when symptoms change. It includes instructions for daily management, recognizing warning signs, and when to seek medical help. Having a clear plan empowers patients to take control of their condition. Doctors help patients identify and avoid asthma triggers such as pollen, dust mites, pet dander, or smoke. Understanding what causes your symptoms is crucial for preventing flare-ups and maintaining good control over your asthma. Doctors review your medications to ensure you're using them correctly and getting the best results. They may adjust dosages or switch medications based on your response and any side effects. Proper medication use is essential for keeping asthma under control. Doctors may ask about your home and work environments to identify potential asthma triggers. They might suggest changes such as using air filters, reducing dust, or avoiding strong odors to help minimize exposure and improve your symptoms. After starting treatment, doctors monitor your response to see if your symptoms improve. They may repeat lung function tests or adjust your medications as needed. This ongoing assessment ensures your asthma is well managed and helps prevent future attacks. Asthma exacerbations or flare-ups can be serious. Doctors teach patients how to recognize early warning signs such as increased coughing, wheezing, or shortness of breath. Prompt action can prevent severe attacks and reduce the need for emergency care. In rare cases, asthma can become life-threatening. Doctors provide clear instructions on when to seek emergency help, such as if you have severe difficulty breathing or your rescue inhaler isn't working. Knowing when to act quickly can save lives. Asthma requires long-term monitoring to keep symptoms under control. Doctors may schedule periodic checkups and encourage you to keep a symptom diary. Regular monitoring helps catch changes early and ensures your treatment remains effective. Empowering patients to manage their asthma is a key goal. Doctors teach self-management skills such as recognizing triggers, using inhalers correctly, and following an action plan. These skills help patients stay healthy and reduce the risk of severe attacks. Family members and caregivers play an important role in supporting asthma patients. Doctors may involve them in education sessions, teaching them how to help during an asthma attack and support daily management. A strong support system can make a big difference in outcomes. Diagnosing asthma in children can be more challenging as symptoms may be subtle or mistaken for other illnesses. Doctors use similar steps but may rely more on symptom patterns, family history, and response to treatment. Special attention is given to growth and development. Asthma can also affect older adults, but diagnosis may be complicated by other health conditions. Doctors carefully review symptoms, medical history, and medication use to distinguish asthma from heart or lung diseases common in this age group. There's a strong link between asthma and allergies. Doctors often look for signs of allergic rhinitis, eczema, or food allergies as these conditions commonly coexist with asthma. Managing allergies can help improve asthma control and reduce symptoms. Workplace exposures can trigger or worsen asthma. Doctors ask about your job and possible irritants such as dust, chemicals, or fumes. Identifying and addressing occupational triggers is essential for effective asthma management. Some people notice their asthma symptoms worsen during certain seasons, often due to pollen or weather changes. Doctors help patients recognize these patterns and adjust treatment or preventive measures accordingly. Respiratory infections like colds or the flu can trigger asthma symptoms or make them worse. Doctors emphasize the importance of vaccinations and prompt treatment of infections to reduce the risk of asthma exacerbations. Physical activity is important for overall health, but some people with asthma may experience symptoms during exercise. Doctors help patients find safe ways to stay active, such as using inhalers before exercise or choosing suitable activities. Living with asthma can affect emotional health. Doctors recognize the impact of stress, anxiety, or depression on asthma control. They may recommend counseling or support groups to help patients cope and maintain a positive outlook. Asthma can change during pregnancy, so doctors monitor symptoms closely and adjust treatment as needed. Good asthma control is important for the health of both mother and baby. Doctors work with patients to ensure safe and effective management throughout pregnancy. Smoking or exposure to secondhand smoke can worsen asthma symptoms and make treatment less effective. Doctors strongly advise quitting smoking and avoiding smoke exposure to improve lung health and asthma control. Poor air quality, such as pollution or smog, can trigger asthma symptoms. Doctors may recommend checking air quality reports and staying indoors on high pollution days. Using air purifiers at home can also help reduce exposure to irritants. While diet doesn't cause asthma, a healthy diet can support overall well-being. Doctors may suggest maintaining a balanced diet, staying hydrated, and avoiding foods that trigger allergies. Good nutrition helps the body cope with illness and recover faster. Vaccinations, such as the flu shot and pneumonia vaccine, are important for people with asthma. These vaccines help prevent respiratory infections that can trigger asthma attacks. Doctors ensure patients are up to date on recommended immunizations. Diagnosing asthma involves a careful, step-by-step process that includes interviews, physical exams, lung function tests, and sometimes specialist referrals. By following these steps, doctors can accurately identify asthma and create a personalized treatment plan. Ongoing monitoring and patient education are key to managing asthma effectively and improving quality of life. If you or someone you know is experiencing symptoms, understanding this process can help you feel more prepared and confident when seeking medical care.